Welcome to Spine Guy. I'm Dr. Brian Su, a fellowship trained spine surgeon. The Spine Guy is a channel dedicated to making the complex spine simple for patients to understand. One of the most common phenomena we see these days is something called tech neck. Tech neck is when people are using cell phones and computers and leaning forward over time, and as a result, the cervical posture starts to degrade, and it starts to degrade very quickly. That can lead to degenerative disc disease, arthritis, neck pain, arm pain, pinched nerve, pinched spinal cord, etc. Typically, patients are born with what's called cervical lordosis, which is a curvature in the neck this way. So this is the back of the skull, this is the jaw, and the cervical spine is supposed to be nice and curved like that. So this would be the side view of my cervical spine. As patients get older and older, just because of disc degeneration, arthritis, they naturally get what's called kyphosis, which is pitching forward the neck. Now, that may be normal as patients get into their 70s, 80s, and 90s, but what's alarming is with the advent of technology, patients getting worse and worse posture. This is an example of a patient that I saw not too long ago, and you can see that this patient's neck is straight and slightly pitched forward when it really should be extended. The amazing thing is, look at when this patient was born, 2004. Today is 2023. So this patient's only 19 years old and already has an arching forward neck that's kyphotic. Well, the good news is, in most younger patients, their lordosis can be restored. Here you can see that this x-ray is of the patient with extension, and when they extend, that lordosis can be restored. So you can actually teach your muscles how to restore lordosis, which is healthier for your neck. Well, today we're going to talk with Jamie Cunha, our head of physical therapy, on what are the 5 best exercises to prevent tech neck, increase lordosis, so you can decrease neck pain. So today I'm here with Jamie. She's our lead physical therapist, and Jamie is going to be our go-to on how we can build up the core strength, increase the posture in your neck, because she's going to talk to us about the 5 best exercises patients can do at home to decrease the risk of tech neck.
So a lot of what we give to our patients is not only directly in the neck, but in the thoracic spine. A lot of patients, because they're in that posture that you were describing, where the shoulders are rounded, the head's forward or flexed, they have tight pecs, stretched out thoracic spine muscles, rotator cuff muscles, and what we like to do is open up the pecs, increase the posture, increase some thoracic spine mobility, and then kind of get the head more in a neutral position. So the first exercise that we usually start with is a doorway pec stretch. And that's where you're putting your hands around shoulder height, and you can play around with the height to what's comfortable. But in a doorway, you stand with good posture and you just gently lean into that. And really, when there's that first moment where you start to feel the stretch, that's where you want to stay, and it should be comfortable and pleasant. Versus you can continue to go a lot farther, but you don't want to overstretch.
You're not doing a push-up against the door. You're
Right.
not going all the way down against the door.
Exactly. So you're just kind of gently opening up those pecs in the door, using the door as some gravity resistance to open up the pecs. And once you hit that spot, it should feel really good. You're going to hold it for a slow count of 30 or timed 30, and then just gently release. And while you're doing it, you just want to pay attention to your neck position, because a lot of people, when they're doing it and holding it, they have a tendency to put themselves in a forward head
To jut their
posture,
chin forward, which is not good.
or look at the floor. So you want to be in good posture when you do that.
And you want to hold it for how long?
30 seconds.
And then do how many reps, would you say?
2 repetitions.
So 2 repetitions, 30 seconds, and how long between?
Give it 30 seconds in between.
So 30 seconds hold, relax 30 seconds, 30 seconds more. Okay.
Yep.
So then we call it the doorway stretch.
Yep.
All right, now exercise number 2.
Cervical retraction. So basically that's when you take what is likely a forward head posture and you just kind of glide back into a neutral spine position, hold for 5 seconds, and then gently release the tension. So what I mean by that is you're just going to kind of let go of the tension in your neck. You're not going to go like this. So if you start like this and you go back like this, you're not going to then go back like this. You're going to come back, hold, and then just let go of the tension. And a couple of things with this one, you don't want to go back so far that you're straining, because that's going to cause other neck pains and issues. It's really should be a very gradual, light exercise that doesn't cause pain.
And how long do you hold that for?
5 seconds, and you do 10 repetitions.
5 seconds, chin tuck back. It's not, a lot of people think by looking up towards the sky,
Right.
You're increasing your lordosis, which is the curvature neck. The reality is the base of the skull in C1, C2, you can have a pitch forward neck posture, but then have a head up posture because you're moving at the base of the skull in C1.
Yep.
So it's not just going like that and looking up. It's trying to chin tuck and taking that entire cervical spine and retracting it back.
Exactly. It's a translation. You're not
So 5
extending,
seconds.
you're not flexing, you're just translating.
Retracting backwards. 5
And-
seconds on, 5 seconds off 10 times.
Yes.
Okay. So exercise number 3.
We call it the open book stretch here. There's lots of other names for it, but it's basically a thoracic spine rotational mobility exercise.
Thoracic over here.
Yep.
Cervical, thoracic, lumbar, thoracic over here in the middle.
So you start on your side, whole body on the side, arms are, together, hands together, and what you're going to do is you're going to slowly rotate and open and follow with your head. And so what you're going to feel, you're going to move slowly, you're going to hold at the end for 2 to 3 seconds and then slowly come back. And this will get thoracic rotational mobility introduced into your spine, as well as cervical rotational mobility and a little pec stretch right at the end. So it's a 3-for-1, great exercise.
And how many reps hold for how long?
10 times per side, and we usually hold it for 3 seconds and come back.
10 times per side, so to the right
10 reps.
and then to the left 10 reps. Okay.
Yep.
So that is exercise number 3. Now exercise number 4.
Exercise number 4, we like TheraBand rows, and you're gonna fold the band in half. I like to put it on the inside of a doorknob and then pull the door shut so that you're not running the risk of it flying off the doorknob and you falling back. And you're gonna kind of take all that we just went through and put it together. So you're gonna set yourself up with your shoulders open, not forward, because we've now stretched out those pecs. We've got your head in neutral because we did the retraction, and we've got some good thoracic mobility, so good posture. And you're gonna take the band, the tails of the band in each hand, and with that good posture, you're just gonna pull back through your shoulder blades and squeeze them gently together. Hold for 2 to 3 seconds and then control the release. And the idea is that you're not straining your neck, you're not pulling back past the range of motion that's available to you and starting to turtle your head. You're just keeping that good posture and building some strength in your thoracic spine to maintain that good posture that we're...
Opens up the chest. And how many reps do you do of that row?
We usually do anywhere from 10 to 15, depending on how much fatigue there is.
10 to 15 reps.
15 is usually doable for most people, and then you take a minute break in between sets, and you're going to do a second set of 15.
Okay. So that is a good example where the cervical spine is part of it, but really you're trying to strengthen the muscles around it, the shoulders, opening up the shoulders to prevent a chest forward posture like that.
Yes.
Okay. So last exercise, number 5.
Last exercise is TheraBand bilateral shoulder external rotation, and you're going to kind of set yourself up with that same, we call it proud chest posture. So your shoulders are open, your head's in neutral, and you're going to have your arms tucked by your sides, elbows bent to 90 degrees, and you're going to hold the band. And with that good posture, you're just going to rotate your forearms out and then control it back in. And again, you don't want to pull so far out that you start straining anything and jutting your head forward or turtling. You're just maintaining good posture, and you're working through the back of your shoulders with your rotator cuff and a little bit between the shoulder blades. And it's another one where you're like you said, it's indirectly affecting the cervical spine because it's affecting your thoracic spine position and the ability to hold your head in good posture.
I mean, I tell patients, if you want to avoid surgery on your cervical spine, you have to have good cervical spine health. Cervical spine health is something that has to be maintained like any part of your health, whether it be doing aerobic exercise for high blood pressure, etc. Something like this is not somebody comes into my clinic, I get an x-ray, they have poor posture, they have kyphosis. Doing this once with you guys in therapy and then not doing anything for 3 months and coming back in to see me, that's not the right thing. So let's talk about how we can maintain good cervical spine posture so that we can prevent things like spine surgery that ultimately some people need, but really are largely preventable because it's a degenerative condition.
So I think that the first 3 exercises that we went through are good for people to do every single day to counter their activities, or throughout your day if you're working at a computer, just standing up and doing a doorway stretch and some open book stretching. Those things are good for your health. And then a couple times a week doing those banded rows and external rotation long term. So I always tell my patients, we do these things. I exercise regularly, but there are always days where you have to also do strength training and postural training and core strengthening, things like that to support your frame.
People that have desk jobs, some people sit at a desk for 8 hours straight. I'm usually telling patients every 15 minutes, either stand up, or you should probably even have a standing desk to begin with just for good ergonomics, but maybe do a chin tuck, do the doorway stretch. You may not have a TheraBand at work, but you could certainly do a couple of those exercises to break up your routine instead of getting pigeonholed in work, 2-3 hours, what becomes 8 hours, and your whole body is like that, and your chin is tucked forward looking at your screen. I mean, I can tell you that in the last 15 years, I've seen younger and younger patients come in, we'll get x-rays, and it's amazing. Some of the older patients, they didn't grow up with technology, even though they're 80, 90 years old, they still have pretty good lordosis in their neck. They still have disc degeneration, but their neck is curved pretty nicely on an x-ray. I'll see 13, 14, 15-year-old kids come in, we get an x-ray and their neck is like pitched forward like you would expect an 80-year-old to be. So I feel like this is something that even young people should be doing, kids that are in middle school and high school. It's not just a disease of young adults. I want to go over 2 other things. One is there are braces that you can wear to try to keep your thoracic spine up with good posture. What's your feeling on bracing for this?
In general, I think most physical therapists would like to get patients to have the muscle strength to
hold their own body.
Yeah, hold their own body. But I think in general for us, our goal is to teach people how to strengthen and stretch and get themselves in fit condition to be able to maintain their own frame in the right way.
But I would say those 5 exercises, doing all those changes in ergonomics, those all have a really good chance of preventing people from degeneration and spine surgery.
We've seen great results here. We've seen people that thought and worried that they were going to need surgery because they had such bad pain down their arm. If you have healthy habits, it's at minimum going to give you a longer period of time of avoiding any major surgery.
So I would recommend, if you have neck pain, you're seeing a doctor, get a prescription for physical therapy, go to somebody like Jamie, learn some of these exercises, maintain these exercises as preventative care. Hopefully you learned the best 5 exercises for preventing cervical kyphosis, improving lordosis or curvature in your neck, so you can prevent neck pain, arm pain, and nerve compression. Thanks for watching. Don't forget to click the like and subscribe button. Look out for more videos in the future.